Hey everyone, Dr. West and Karen at the West Clinic. I invited Karen to share a message of hope with other people because the thing that stuck out with me when she came in just a little while ago is you're out of hope, right?
Yes.
So Karen, to the extent that you're comfortable, tell everyone like what did you feel like or what happened? What brought you to the office? I mean, I know you were here before, but it was just in March that happened.
In February. I
February,
was
sorry.
diagnosed with COVID pneumonia on the 16th of February, ended up in ICU the next day, and they wanted to intubate me, and they wanted to shock my heart because of my AFib. I was against it. I was in there for 7 days, and I left the hospital against doctor's orders because I did not feel I was getting the quality care that I should have gotten.
And so your husband was there. You were fighting for you're like, hey, I want to be treated a different way. Your husband was like, his story is just as fascinating as your story. But after you said, look, I don't want to be intubated, you decided to do something else. Like, how did that lead to becoming here?
My husband called the clinic and said, this is what's going on. This is how she's feeling.
And how
Can
were
you
you
help?
feeling? Like, to just walk everybody through,
I
because we saw you in
was-
oxygen and
Yes, I was unable to roll out of bed by myself. I was unable to shower by myself. I was walking with a walker. It took 2 people to help me get up out of the chair, and I was unable to do anything.
and I saw you and you said, look, I just feel like there's no hope. Now, we didn't feel that way, but
Yep.
what happened with the journey as we started to try and put you back together? Because again, you're in a walker,
Yep.
you've got oxygen going 24/7.
4 liters of oxygen. We showed up the following Monday, and it was tough. I could hardly walk, and they finally ended up putting me in a room, and everyone came to me. And this is a month later, and I'm off oxygen at night. I'm off oxygen during the day. I'm only on it at night. I can walk by myself. I can shower by myself. I can fix meals by myself. It's amazing. I feel so much better.
And you're not perfect, but you're nearly perfect.
Yes.
I mean, and again, just seeing someone that wasn't a walker out of a walker, you don't need the oxygen anymore. So if people are watching this, and I asked you to do it because I wanted to give people that were, hey, whether it's long haul COVID or some other things, to give them some options. So what kind of treatments were you given at the clinic?
I was given IV treatments, neurotherapy, and diatherm.
Okay, so what she's talking about is we do the infusion treatments with vitamin C and magnesium and lots of zinc. And then there's a specific way where we do an oxidative medicine treatment to get extra oxygen into the system. And then the diathermy is an old school machine that comes out of the literally 20s and 30s. And what it does is it helps to dilate. This is really good for lung conditions. It opens it up so that you can actually really improve your oxidative pathway, getting oxygen in and out of the system. It's something my dad taught. Ed, do you know anybody else with a diathermy?
No.
Yeah, so like it's one of those forgotten medical treatment things. It's just amazing for lung function. It's called a diathermy machine. And then the neural therapy. How would you describe neural therapy to someone thinking about how can I get my health back?
Oh, it's so painful, but it's so worth it. Immediate results.
We'll edit that out. No, I'm just joking. We're not editing anything with that, but it's an injection therapy. And what does it feel like?
Pin needles, and sometimes you get a certain area that's inflamed, I guess.
Yeah.
It hurts. I can't even think of the word. It's so painful. It burns.
So what we're doing with those areas is we're trying to reset the system. So we use a special type of B vitamin. We go into these specific areas over hot spots, like over the lung fields, just really superficial, and it makes the nerves open, close, and reset. Like we talk about neural therapy on nearly every week on our live show, on our testimonials, and just like Karen said, it's not a pleasant treatment, but wow, does it help you, doesn't it?
It does.
So that opens up the lung fields. You told me today, hey, my hope's back, where things will get better. So, Karen, I found that most people with a really serious sickness or autoimmune disorder, there's always a kind of a life lesson in there. And so if someone's watching this across the street or across the country if there was a lesson or something that you've learned in this process, what would you want people to understand about this as far as like the making lemonade out of lemons?
Don't give up. There's always hope.
Always hope. We always talk about the office. You're not your diagnosis. There's always hope. Just a really neat experience from, a pneumonia related to the pandemic and the infection that's occurring. Had a fantastic response. No walker, no assistance, no oxygen. And how long has it been?
4 weeks.
4 weeks.
I'm still weak, but so much better. It's a long road.
All right. So you guys, we just a fun experience. You're not your diagnosis. If you work on the immune system and work on getting things balanced, then you can have outcomes just like Karen. It's not just me that does it. There's functional medicine doctors all across the country. You just got to find them and don't give up hope. Just keep after it. Dr. West and Karen, we'll see you guys on the next video.